Well, thanks everybody for being here. My name is Vance Lewis, Senior Program Manager at Promise Venture Studio, and have the distinct pleasure of leading our Show+Tell series on equity and justice in early childhood, and am ecstatic today to chat with a few of the people instrumental in getting the birth equity bill package passed in Colorado. So we are grateful for all of your work every day, and specifically for your time today to chat with us. So let's hear from them right now. So first, I'd love to just start with a quick introductions, your name, your title, your organization. I'll start alphabetically. So Briana, I'll kick it off with you.
Perfect. Thank you so much for having me. My name is Briana Simmons. Pronouns are she, her, and hers. I'm the Black Women's Health, Healing, and Joy Coordinator for Soul to Soul Sisters.
My name is Demetra Seriki. I am a home birth midwife, also known as a certified professional midwife in El Paso County. And I also have the distinct honor of sitting on the board of Elephant Circle. Thank you for having me.
Hi there, Indra Lusero, Director of Elephant Circle. They, them pronouns. Happy to be here.
Hey folks, Kayla Frawley with Clayton Early Learning. I'm the policy manager over there, and I co-convene the Raise Colorado Coalition and manage the Parent Ambassador Program. Happy to be here.
Hey everyone, I'm State Representative Leslie Horod. I represent House District 8 in Denver, and proud to work with these amazing advocates on the Omnibus package.
So to kick it off, Indra, maybe I'll start with you, and then anybody else can jump in. What is the birth equity bill package, and why is it needed?
It's a set of bills that collectively cover over 24 different policy areas that we think will start to address inequities in birth outcomes. It's needed because of those inequities, but it's also needed because care that everyone receives in the United States during the perinatal period is inadequate and subpar. We have some of the worst quality of care at the highest cost in the world. We're paying more and getting less than people in other countries. And so when there are disparities, I think it really emphasizes how poor the poorest care is in this country, because it's subpar for our best outcomes. And when there's a disparity, especially based on race, that's, inequitable, that means, there's really a profound gap, and we can do better. So that's what the bills do, is try to tackle the interrelated problems that lead us to this unfortunate status quo.
I think something that we've talked a lot about throughout legislative session when talking about this bill package is that it really designs a framework to approach maternity and infant care with a human rights approach. And that is following global leadership and initiatives to really frame how we need to apply human rights framework to maternity care. And so I feel like that is also a very big piece to why the components are addressing very specific populations in the way that they're addressing them. And why many of these components, really try to tackle specific disparities that very specific communities face.
We also developed these policies after years of listening to people. And that would be people who were experiencing care and people who were providing care, people who were supportive during care, like doulas. And through hearing from a wide range of people over a lot of time, we saw, all these different points in the system that needed intervention in order to improve. And certainly I learned a lot personally from Mimi, who is a practicing midwife, and a lot of the barriers that she brought to my attention, these bills try to address.
And I'd like to add that the bills in particular move theory to action, which is really important. Structures and institutions have the evidence. The evidence is widely available. And so when we review current recommendations and current literature, oftentimes we, in theory, recognize the shortfalls and the poor outcomes. However, we, as a community, there are very few leaders who will actually take and move those theories into a legislative process. And that's exactly what these bills did.
I would just add that the bills set a standard of care. They also set a standard of accountability for a healthcare system. And on top of that, and one of the things that I think is most important about these bills is that it's responsive to community needs. Indra spoke to it a little bit, but over the years, I've been in Colorado for 6 years, and many of the people on this panel have been here much longer than I have. But when I entered into the birth worker field here in Colorado, communities were very loud and very clear about their experiences. And I think that this bill package finally addresses many aspects of what they were asking for.
I'll add briefly, my mom is an OBGYN, and she got into this line of work because of the horrible birth rates and maternal mortality rates for Black women. Specifically for Black women. And we've known about this for generations. So she got in as an OBGYN, as a Black woman, to help other Black women. But still, a generation later, we are still seeing poor outcomes. In fact, 1 in 6 pregnant people of all races are experiencing some form of mistreatment in the system. But for people of color, it's 1 in 3. And that leads to disastrous and tragic outcomes for women of color who are people of color who are giving birth, right? And so this is something that we really have to address. Legislators, mostly led by women of color, Black women across the nation, have decided to take on this issue and tackle it in a real way, a legislative way, to add on to the work that so many folks are doing here today, that you see represented here today. And the thing that I think is the beauty of this package is that not only does it change points in the system that need to change that will lead to better outcomes for everyone, it also expands the system so that if you choose not to give birth in a traditional way, or you are in an untraditional setting, that you're still going to have good health outcomes, and that there still will be accountability there, which I think is important. Including doulas and midwives into the process is very important, giving them the respect, right, and the accountability that they need to serve women is extremely important. And quite frankly, it's a direction that more women of color are going in right now because of the disastrous outcomes in the traditional healthcare setting. And these bills really bring those different ideas and worlds together in a way that I think will truly be transformative, or at least begin on the process of transformation, so that we can change those health outcomes, not only in Colorado, but across the country.
Thank you all so much for that, for those answers. And we keep saying these bills. So before I go, I would love to hear about like the deep listening that you did with community, and hear some stories about how that process happened and how that led then to the drafting of these bills. But before we get there, like, how many bills are we talking about? What are these 2 bills? And you've mentioned some of the stuff that comes through them, but a little bit about like, this bill does this bill did this, we had to do them together. Something a little bit about why the package was so important.
I hesitate just a little bit because we kind of branded 3 bills as part of the birth equity bill package. But one of them is unique because it was a sunset of Colorado's direct entry midwifery law. So it was a law that already existed and was essentially just being reviewed or renewed. And then 2 other bills were brand new bills. So they're a little different, but essentially we're talking about 3 bills. And the reason that they needed to be together is to communicate that addressing this issue requires a multi-pronged approach. It's to get out of what we think contributes to the problem, which is this idea that it can be tackled by, one single policy or in one particular clinical way. But what we hope these bills communicate by being multi-pronged is that, no, don't think that you can just fix these problems in a simplistic way. You really have to look at the big picture. You have to understand how parts interact with each other, and you have to think holistically. So that's what these 3 bills do. Senate Bill 193 and Senate Bill 194. We think of them as Senate Bill 193 is the human rights is a health outcome bill. And then Senate Bill 194 we think of as the data systems and equity bill. Each of them have many components, so it's hard to, quickly break it down. But those are the overarching, themes in each of those bills.
And Rep. Horod, I'd love to hear a little bit from your perspective about the process of being in the legislature with them. And was it a difficult process, or was it something that was easy, knowing that you had the community behind you and the votes?
Yeah. Well, so in Colorado, we have these unique ways of doing bills, and every state is different. So for folks who are watching who are not from Colorado, who are interested in making this work move forward in their states, I think it's really important to understand kind of what the rules are for writing legislation. In our state, we have to be able to fit under a single title that's not too broad, that it could get hijacked by folks who maybe have other intentions for the bill, right? And I think we kind of skirted that a little bit with these bills. So we have one that's dealing with that we're calling pregnant people in the prison system, 193, and then we also have one that is just maternal health, 194. And I think it was really important to kind of brand those a bit broader, because we were trying to be, one, inclusive, especially for those who are outside of the gender binary, but also because we wanted to be inclusive and help folks understand that we have terrible maternal mortality and infant mortality rates in this country for everybody. It's worse for women of color, but it's terrible for everyone. Okay. We are, behind every developed country when it comes to birthing outcomes, but we pay the most to go through the birthing process. So it's the most expensive for the worst outcomes. Like, that cannot be understated. Every state, every system needs to be working on this, And I think when you bring that data point forward, and again, thanks to the advocates here and the advocates across the country who have been lifting this up, because we're sick of primarily women of color dying, people of color dying, but also everyone in the system. That once you have those conversations, and they've been going on for years, they've been brewing and building, it's much easier for folks to understand why this is important. And so we did have support from the Democrats, specifically my caucus, around these bills. But we also had the leadership of the Black Caucus, which I am the chair of. And so the Black Caucus came and stood behind this bill, these bills, with a united front. And I think that was really important because of that, we were able to lift up the voices of women of color specifically, to have the conversation and to lead the conversation about why these bills were important and why we must do something now. And I believe that backing, so that legitimacy that unfortunately, legislators have to give, right, to these community members who are doing the actual work, made it much easier to negotiate some of these key provisions that could have been very sticky, especially around the systems change, working with the hospitals, working with insurers and things like that. But I think that it is vitally important that the advocates were there, that the community was standing with the advocates. And then we also had experts like Elephant Circle who can ensure that the intent of the advocates was translated into the policy that we now see in the bills.
Awesome. Thank you, Rep. Horod. So I'd love to pivot and hear a little bit about that, listening to the community, work that you all had done, and kind of the roles that each of you had kind of played in that. Indra, I know when we had talked, you mentioned that this comes off of kind of decades of like deep listening to community. Would love to hear, kind of each of you talk about like, what was that process like, and what was your role kind of in that process, and how that then transformed into kind of what went into the birth equity bills.
Sure, I'll go ahead and start, but I really look forward to what everyone has to say about this. But Elephant Circle started in 2009. And that was even a few years after I knew personally that working in this field, which was barely even a field at the time, was my calling. And because it was a small nonprofit, I could really just grow it incrementally in response to what I was hearing from community. Of course, I was informed by my own experience as a queer person starting a family in Colorado. I was also deeply informed by somebody who's so deeply connected to this land and this region. I was able to really see imprinted here in this space the difference between how my great-grandmother, who gave birth 11 times in Colorado, before there was the kind of healthcare infrastructure we see today. But knowing that the kind of wisdom she brought to that experience was essentially replaced by this other system that we now see so clearly is a failed system. So first of all, I was informed by those personal experiences, but then through the process of just saying, hey, we're in this space, we care about this intersection of birth and human rights and reproductive justice with regard to family formation and giving birth. We started hearing from people. We started hearing from midwives and doulas and people who had been harmed during the process. And of course, at the beginning, it was just like painful because we didn't have solutions. So it's been a process of trying to get the capacity to start solving some things. But it was really fortunate, and because of these relationships with these people here and others, that we could build on this opportunity. Like Representative Horod said, that the Black Caucus identified this as a priority area. And fortunately, we got to be connected so that we could help inform that goal. And actually, I'd love, Kayla was really instrumental in building that bridge. So I'd love to pitch it to you, Kayla.
Yeah, I'd love to talk about, a report that we were able to kind of do alongside as the beginning of the bill development was happening with Coloradans. But just to piggyback off of some historical involvement in the community, I was a former home birth midwife, and I was trained and licensed back in 2012. And shortly after that, I became a midwifery educator. So I built curriculum for 3 different midwifery institutions to talk to students about racial disparities, other health disparities, and the exact stats and numbers that I talked to students about in 2013 persist today, right? So there's just been no change in any of that. So just to piggyback off of what Rep. Horod and Indra were both saying, but I have this in front of me. So this is the Diverse Colorado Voices report. And our friend Shelby Irvin, who was a huge leader in this report, is on the cover, who's also in El Paso County with Demetra. And we were able to hear from 77 birth equity leaders around the state, the majority of them being birth workers out of the hospital system, but perinatal professionals and or parents, and majority of them were BIPOC Coloradans. And so we asked them what were the biggest issues and what are the best solutions to issues that we see in the perinatal time period or in infant and maternal care. And the top 3 issue buckets were, number 1 was systemic racism. And so we heard, a lot of different stories of folks that had experienced explicit racism, and how that impacted their pregnancy and their postpartum up to 2 years. And then the second bucket was lack of postpartum supports, more predominantly lack of lactation supports and mental health supports. And then the third bucket was systems level inadequacies. That's when a lot of Coloradans talked about how we have, insurance policies that are very inequitable. They don't allow for folks to choose which provider they'd like to go with. They don't allow folks a lot of autonomy in the care that they receive. And other systems level inadequacies like departments not speaking to each other, transfers from out of hospital birth to in hospital birth, and how that's an issue. And so this report was launched sort of right at the beginning almost of legislative session 2021. It is the most up-to-date data we have from birthing Coloradans and birth workers in Colorado that really help to define what those issues are. In their solutions and policy recommendations, they gave 24 different policy recommendations, many of which are in this birth equity bill package. And and some that hopefully we can expand on, in another session. But that was very informative in the process, specifically for some of our lawmakers who might be brand new to the sector of the perinatal period and or maternal health, right? This was providing some great literature for them to say, look, Coloradans are saying this. These issues persist. These are the same issues we've been hearing from the community for decades, So that was a big piece in advocacy around the bill package.
Thank you, Kayla. Briana and Mimi, I'd love to hear from you two as well, and call you in here around the community advocacy, community listening work that you all had done leading up to this, that I'm sure was instrumental to the package as well.
Can I just jump in real quick before we do? I just want to highlight something that Kayla said, really around the issues that were identified as ones that needed to be addressed, specifically after giving birth, and things like mental health, right, and not knowing how to properly breastfeed if that's what you choose to do, and things like that, and how that really impacts someone's ability not only to stay healthy themselves, but their children. And so, I wanted to kick it off to our two amazing practitioners here, because the reason why that's so hard and leads to disastrous outcomes is not because people don't identify their own pain or their own issues. It's because they're not believed in the system, especially when they're being reported by women of color, but also by women and by people who are outside the gender binary. They're just not believed in the system. They're just not seen as credible. And we need advocates who first start with believing us, right? In order to get the help that we need. And these folks are the practitioners who do that work.
Thank you, Representative Perry. My perspective in the stakeholder process was a little different because I am a practicing midwife, and as such, I bring forward, in some cases, cases that were actively taking place, and utilizing Elephant Circle as a resource, oftentimes with many of the families that I am working with. And so that framework of conversation, as Indra referenced, comes from the perspective of working in community, being with community, and not just hearing their stories and wanting to amplify them, but again, moving those stories to a place where they could be heard. And just like Representative Harris mentioned earlier, BIPOC communities, communities of color, and our non-binary folks are not heard, and not being heard. They are not being believed, and in not being believed, they are at an extraordinarily high risk of infant or maternal mortality. So having the ability to have conversations with community members, being able to make connections, which was a big part of my piece of the stakeholder process, was being able just to connect the dots, connect community with other organizations who were also working to bring this package forward, such as the surveys and the community engagement that Kayla is referencing too. I also, as a practitioner, have a lived experience as well, right? That helped framed how I became a midwife. I'm born and raised here in Colorado, and became a midwife in 2015, and chose that pathway based off of my own lived experience. And just to bring some perspective, I have 4 sisters, and of my 4 sisters during our childbearing years, 3 of us nearly lost our lives here in Colorado. So that just hopefully gives some perspective. 4 sisters, childbearing age, 3 of us, at some point or another, were at risk of losing our lives. And that looked different. Some of us wound up in emergency surgeries that could have been prevented. Some of us almost lost our lives. And again, it could have been prevented. So I think for me as a practitioner, it was important to close the loopholes, particularly being an out-of-hospital midwife. Oftentimes having to navigate those structures and systems is quite complex. And in an emergency situation, time is of the essence, and needing to navigate is something that I shouldn't have to do, not when there are lives on the line. And so these bills help to ensure that when those instances do occur, that those intersections will be met with less resistance and trauma. And I think that's really important. More so right now during COVID. COVID exposed a unique vulnerability that we have in our perinatal care system. For those of us who work in that system, we've always known that it has existed. But COVID, being in a pandemic, really showed the vulnerability that birthing families of Colorado were experiencing. So it was my job to bring those forward and help make connections from community through community.
Yeah, so from my perspective, as it relates to the stakeholder process and community involvement in this work, at the time that I entered the conversation, there were actually a lot of proposed legislation on the table for addressing maternal health. And to my understanding, many of those things didn't move forward because the community said, wait, we aren't a part of this process at all. How is it that these things can move forward without it being truly informed by our lived experiences? And so with my role as a doula, I felt it very important to utilize the uniqueness of my role in having very close personal relationships and having had built trust with the families that I was working with to be an advocate for the things that they were communicating that they needed to be reflected in policy and legislation. And so a lot of my role was utilizing my voice to speak to some of the issues that I was gathering from their experiences, but also to help mobilize other Black doulas in our state to get involved with the process as well. I love being a doula, and I think that the position that we hold is very sacred. And as Mimi started to touch on, COVID also really revealed the lack of integration of doulas into our healthcare system as well. And that's truly unfortunate because so much can be done when we integrate those relationships and we make it so that doulas are truly a part of the healthcare of the birth team, and sitting beside a person and being able to help them achieve and accomplish the experiences that they absolutely deserve is a really special thing. And then to be able to translate those things into policy that will hold folks accountable to making those options available to families is, I think, where I contributed the most.
Awesome. Thank you, Briana, and thank you, Mimi and Indra and Kayla and Rep Hair for sharing very powerful stories and also ones that are vulnerable. And I do appreciate you opening up here and sharing that with us. What advice do you have for people who might say, like, this is well, everybody's going to say this is incredible, but what do you advise to people that say, I hear this and now I'm inspired to go and do something? I want to do this in my state or in my community. What advice do you have for them?
Yeah, I'll start by just saying, seek out people who are already doing the work. Because undoubtedly there are folks in the community that are doing the work. There are doulas, there are midwives, there are elephant circles in a lot of our communities because the outcomes have been so bad. We have had to do something different, and those professions I mentioned are really exploding. There are a lot of amazing, trained and supportive midwives and doulas that we need to lift up. And so I would say seek that out. And if it's not there, build a community of people who care about these issues, who look like the communities that are most impacted, and then move the work from there. A lot of folks think that they should start with their elected officials. You can, but the better place to start is from the community. That is where I get my information, my research, my knowledge is by working with the community and working through folks like the ones here today. I will tell you, I learned, even though my mom's OBGYN, okay, I learned so much more about the process and about the pain and the real life experience of people who are dealing with these issues through the two women that you see here today, and others who testified about what the real experience looked like. And I also saw some of the hardships that they faced without having that legislative support and leadership as well. And so it is a partnership, but I will say that partnership first starts with community.
Well, I have a message both to people who are already a part of systems, institutions, agencies that have within their purview maternal health, and people who are outside of that system, people who are part of the community health system that Representative Horod said exists because it has to exist. It is possible, and I think important, to do policy like this with community in the lead. So if you are in one of those agency positions or institutions, this is an opportunity for you to step back, to take a more listening position, to let community lead. And if you're part of community and you feel like it's insurmountable and overwhelming and daunting, let us be here to tell you that it's possible, that you can do this. We did pull this off, and just let me tell you, we are incredibly under-resourced. We did not have a budget for this. This was not in our plan for 2021. We had to move with the momentum. And what you get when you do that with community is you get a lot of resources. They're just not the traditional resources. We had each other, we had energy, we had expertise. We have a fact sheet on our website that we created in the middle of this process, which is called What is Community-Based? Because we realized that we were changing the conversation just by showing up as different people in a different way. And that's part of changing this system. So it can be done. It can be done.
I was just going to add that the end goal, right, is vastly important to the impact of people's lives. But I think that something that gets missed in the vision of that sometimes is the process in which that happens. So the how we get to the end goal is extremely important, especially when you're doing community-based work. So when you're asking parents and birthing people and people of varying identities to show up fully in a way and to share their stories, sometimes those stories can be very traumatic and can bring up a lot of things for people. So ensuring that people are compensated for their time, ensuring that people have the resources in the interim to address their basic needs, those types of things can really dignify the legislative process in a way that's absolutely necessary, and that was utilized in this process as well.
I was just going to add, I think some of us are still surprised that these bold pieces of legislation even passed. I think that they're a gigantic deal and really lay a great blueprint. And I think the point of community leading this is definitely the light and the North Star. And I think equally in the implementation process, we must ensure that is gatekept for community as well, and in a sense, just so that is done right. And I think, something that comes to mind as far as, doing something similar is, we know that there is enough data, like this conversation, that we need more data on racism, on the impact of racism in the perinatal period. Like, we don't need any more data. It is there. And stories amount to a significant amount of data on their own. And so I think that knowing that, that we don't need to wait to do some of these certain things, and that they can be done in very, on very small teams that are very mighty. Like, it's very possible if you have, one or two lawmakers that happen to, be able to carry something like this and believe something like this, it's very possible to do. I think another thing, that I think about is that for folks that might work in philanthropy or in grant making, like we have to start looking at a more anti-racist lens in regards to application processes, disseminating of grant monies, of seed monies. And then even in any kind of data collection whatsoever, we have to start to decolonize methodology. The only reason that systemic race, like if there wasn't a anti-racist lens into the data that we collected from Coloradans, we might not be able to have identified that all of these examples that one might not think are forms of systemic racism, like malpractice insurance practices, right? Like how those are perpetuating systemic racism. We wouldn't have known that that's what Coloradans were saying, right? So there's a lot of, I think, examples that sometimes are taken really out of context. And aren't taken seriously as kind of metrics of what systemic racism is doing to folks. So all that to say, I would just agree with, the entire team there that everything really lies within community. Solutions have been in community for a very, very long time.
Awesome. Thank you, Kayla. I know we're running up on time. So let me ask this last question. And then if people have to hop, then please feel free. But thank you in advance in case you hop. What's next, and how can people support you all?
I'm going to have to jump off, so I will start by just saying, again, thank you to all the amazing people who are doing this work, both on this call and outside of the call. You are definitely saving lives, and it's so very important. So thank you for all that you're doing. For me, what's next is basically whatever the community asks for us to do. And so as you see, this momentum is here. We have made tremendous gains, but there is still so much more work to do. I would say make sure to engage, make sure to work with some of these folks. Feel free to reach out to my office, and let's figure out what the next steps are so that we can truly have equitable birthing process. That's all we're asking for here, and one where we know we'll survive. Right, that is what we're asking for, and then we should also be talking about how we thrive as well. So I just want to again thank everyone for what they're doing. Thank you for putting this call together. I'm State Representative Leslie Horod, and I look forward to future conversations. Thanks. Bye.
And I actually just want to point out, celebrate some of Representative Horod's incredible leadership with regard to police accountability. In terms of what's next, I think carrying forward that work and this work are, and seeing through the implementation of these important policies, and they are connected. I just want to emphasize that I see Representative Horod as a leader in perinatal care because she's a leader in police accountability and criminal justice reform. So what's next is continuing to build those bridges and illustrate those connections and show people how our health and wellness as communities, as people, are connected to all these systems. Like it's no longer, isolated, small solutions. It's time for bold solutions and system-wide solutions. So what's next? This is just the beginning. I mean, this is just the beginning for us. Literally, this was phase one of at least a 3-phase plan.
Briana, Mimi, or Kayla, anything else you want to add on the what's next front, or how people can support you?
For me, it's going to go right back to what I said from the beginning, just moving that legislation into community, educating community on what this legislation is, how it can benefit and support and protect their families, and also for our incarcerated families, for folks that are incarcerated and are not aware of this monumental shift in their care. I think this is really important. So I will be taking this from that legislative table into community, educating community, to empower community to improve their outcomes. So I just see growth. I see a community that is breaking free of the incarcerated chains of systemic racism and poor perinatal health. This is a step in the right place. And hopefully with Colorado making such monumental gains with this legislation, we'll gain more providers of color. Because that's big. Representation matters. And we don't have that right now. So it is also something that I hope that folks will see this and say, I want to be a part of that. And I want to, as a person of color, or a non-binary provider, I want to come and help move that change forward, in a very macro perspective.
I think in terms of next steps, implementing these pieces of legislation feels like a big deal. And so I'm excited to see that through. But I think, to both Indra and Rep. Herod's point, I think that, what is so beautiful about these pieces of legislation, and what was so beautiful about recognizing not just Rep. Herod, but Senator Buckner also as leaders and potential sponsors of these bill pieces, is we knew that they are not scared of intersectional issues and addressing them innovatively, And so I think that going forward, that just these pieces of legislation kind of do start to help to continue the trailblazing of approaching intersectional issues that do have to do with undoing systemic racism. And so I think that's just exciting in itself. And so I also look forward to the next number of years and different phases that we have in Colorado in regards to birth equity.
For me, implementation looks like ensuring that there is adherence to what is outlined within the bill package. Implementation looks like, for me, legitimizing a doula's role in the birth team, in which they receive an equitable wage. So many doulas who I know and work with, including myself, have the desire to do doula work full time, but with the other isms that we are facing in the world, it's difficult, and Black doulas in particular, are stretched thin. Black birth workers are stretched thin, attempting to be the bridge between those gaps. And so legitimizing a doula's role within the field and ensuring that folks can show up in the ways that they want to feels like a part of implementation for me. But most importantly, I think I really want people to feel like the impact of this bill package. The bill package itself and all the components of it aren't meant to serve as lip service to the issues that we're attempting to address. Like, we truly want communities to be impacted and to feel the change in these bills.
Thank you for that. And thank you all for joining this panel. Again, thank you for the work you do every day. Thank you for the time today chatting. Thank you for your openness with sharing your stories. And thank you for imparting your wisdom on me, for sure, and anybody else that is listening to this. So thank you so much. And I'm excited to follow what's going on with the birth equity bill package as it goes into implementation.